Most people believe that if their doctor prescribes a medication, it must be helping their heart. They take it every single day for years, decades even, never questioning it. And a 68-year-old retired teacher named Margaret believed that too. She took her blood pressure pill religiously for 12 years, never missed a dose, did everything right, walked every morning, ate her vegetables, stayed on top of her checkups, and then one afternoon, completely out of nowhere, her heart started failing. Not a heart attack. Heart failure. Her cardiologist ordered an ultrasound. When the images came back, he found something he didn't expect. Her heart muscle had become stiff, calcified, like bone forming where soft tissue should be, and the medication she'd been taking to protect her heart had been quietly, invisibly contributing to that calcification every single night while she slept. Here's what nobody told her. Well, what I'm going to tell you today. My name is Dr. Samuel Morrison. I'm a cardiothoracic surgeon with 28 years in the operating room. I've opened over 2,300 chests in my career. I've held beating hearts in my hands, and I've spent nearly 3 decades watching the same preventable patterns repeat. Patients who did everything right, who followed every instruction their doctors gave them, who never missed an appointment, and still ended up on my table. The problem isn't that doctors mean harm. The problem is that the 12-minute appointment doesn't leave room to explain what happens after you swallow that pill. What it does to your magnesium, what it does to your calcium, what it does to the delicate balance your aging heart depends on. Today, I'm going to tell you what nobody took the time to explain to them. After 60, your body becomes a different machine. Not worse, just different. Think of it like this. When a car is new, it has factory parts and tight seals. A small oil leak doesn't matter much because everything else is compensating perfectly. But after 200,000 miles, that same small leak becomes critical. The gaskets are worn. The tolerances are tighter. The margin for error has shrunk dramatically. Your heart is the same. At 30, your heart can handle almost anything you throw at it. Poor sleep, stress, bad food choices, dehydration. It compensates beautifully. But after 60, that compensation system weakens significantly. Your kidneys don't filter as efficiently as they once did. Your liver doesn't metabolize medications the same way. And your heart muscle itself becomes less forgiving of insults. More than half of all adults over 65 are on at least 3 prescription medications daily. Many are on 5 or more pills every single day. And here's the part that almost nobody talks about, honestly. Every single one of those medications depletes something critical from your body. Magnesium. And that's so on the net cap. Potassium, coenzyme Q10, vitamin B12, nutrients your heart needs to function. And when those nutrients drop below a critical threshold, your heart begins to struggle. Not suddenly, quietly, over years. Now, the medication I'm talking about today is one you've probably heard of. Millions of seniors take it. It's prescribed more than almost any other drug for high blood pressure. And in many cases, it works. It brings blood pressure numbers down. It reduces stroke risk in the short term. But here's what happens that your doctor probably never explained. This medication doesn't just lower your blood pressure. It also depletes your body's stores of magnesium and coenzyme Q10, 2 nutrients your heart cannot function without. Let me be very specific about what that means. First, magnesium. And that's so on the net cap. Your heart uses magnesium to maintain a steady rhythm, every single beat. When magnesium levels drop, those signals become erratic. You might feel palpitations, fluttering, a sense that your heart is skipping beats. But here's the problem. Those symptoms are subtle. Most people dismiss them. And when you mention them to your doctor, the response is often, "That's normal for your age." It's not. It's your heart telling you it's running low on the fuel it needs. After 60, your kidneys already excrete more magnesium than they did when you were younger. Now add a medication that actively pulls even more out. The deficit compounds, night after night, year after year. A patient I'll call Robert came to me at 71. He'd been on this medication for 9 years. Good man. Former electrician. Sharp mind. And does so in. He told me he'd been experiencing irregular heartbeats for about 2 years. His primary care doctor had run an EKG. It showed premature ventricular contractions. PVCs, not dangerous on their own, but a sign that something is off. Robert's doctor told him to reduce caffeine and manage stress. Robert did both. The PVCs didn't stop. When I checked his labs, his magnesium level was at the very bottom of the normal range. Technically not deficient, but nowhere near optimal for a heart under the stress of aging. I asked him what medications he was taking. When he told me, I knew immediately what was happening. I had him start supplementing with 400 milligrams of magnesium glycinate every evening. Within 3 weeks, the PVCs were gone. Completely. Robert looked at me and said, "Why didn't anyone check this 9 years ago?" Astanden indandats. That question stayed with me. Here's the second problem. Coenzyme Q10. Your heart is the most energy-demanding organ in your body. It beats 100,000 times a day without rest. To generate that energy, your heart cells rely on mitochondria. And coenzyme Q10 is the fuel those power plants run on. Without enough CoQ10, your heart begins to weaken, not because of disease, because of depletion. This medication blocks the same pathway your body uses to produce CoQ10. The longer you take it, the lower your levels drop. And here's what makes this dangerous after 60. Your body's natural production of CoQ10 already declines with age. By the time you're 70, you're producing about half as much as you did at 25. Now put someone on a medication that blocks what little production they have left. The result is predictable. Fatigue, shortness of breath with mild exertion, a sense that your stamina is gone. Doctors often attribute these symptoms to getting older. But in many cases, it's not age. It's medication-induced nutrient depletion. Let me ask you something. Has your doctor ever checked your magnesium level or your CoQ10 level? Most people I ask say no. It's not part of the standard panel. And because it's not checked, the depletion goes unnoticed until symptoms become severe enough to raise alarms. By that point, the damage has often been accumulating for years. Here's the fix. If you're on this medication, ask your doctor to check your magnesium level, not just once, every 6 months. And if you're going to stay on the medication long term, supplement with magnesium glycinate, 400 milligrams every evening with food. It's inexpensive, it's safe, and it can prevent the slow erosion of your heart's electrical stability. For CoQ10, the dose is higher, 100 to 200 milligrams daily. Take it with a meal that contains fat because CoQ10 is fat soluble. Your body can't absorb it properly on an empty stomach. Write that down. Stay with me because this next one is the hardest to talk about. This medication doesn't just deplete magnesium and CoQ10. It disrupts your body's ability to regulate calcium. Calcium is essential. Your bones need it. Your muscles need it. But calcium has to stay in the right places. In your bones, calcium makes you strong. In your arteries, calcium makes you brittle. After 60, your body's ability to direct calcium to the right places weakens. That's calcium leaving your bones. But at the same time, many people are experiencing vascular calcification. Calcium entering the walls of their arteries, hardening them, making them stiff. This is called the calcium paradox. Bones losing calcium while arteries gain it. And this medication can accelerate that process. Here's how. This medication works by blocking vitamin K-dependent proteins. Those proteins are responsible for keeping calcium out of your arteries and directing it into your bones where it belongs. When you block those proteins, calcium begins to deposit in soft tissues, including the walls of your arteries and including the valves of your heart. Over years, this creates a slow, invisible problem. Your arteries stiffen. your heart valves calcify, and your heart has to work harder to pump blood through a system that's become less flexible. The tragedy is that this is preventable, but it requires a conversation most doctors don't have time to initiate during a standard checkup, and most patients don't know to ask. A woman I'll call Linda came to me at 74. She'd been on this medication for 16 years. Her blood pressure was well controlled, but she'd started experiencing chest tightness during her walks. Not pain, just pressure. Her cardiologist ordered a stress test. It came back normal. Then he ordered a CT scan of her coronary arteries to check for blockages. What the scan showed wasn't blockages. It was calcification. Heavy calcification throughout her coronary arteries. Linda's cholesterol was fine. Her diet was good. She didn't smoke. But the calcium score on that scan was alarmingly high for someone without traditional risk factors. I asked about her medications. When she mentioned this one, I immediately asked whether anyone had ever discussed vitamin K2 with her. She had no idea what I was talking about. Nobody had mentioned it, not once in 16 years. Let me be very clear about the age-specific risk here. After 60, your arteries naturally become less elastic. They lose their ability to expand and contract smoothly with each heartbeat. That's normal aging. But when you add vascular calcification on top of normal age-related stiffening, you're compounding the problem. Your heart has to generate more force to push blood through stiffer arteries. Over time, that extra work causes the heart muscle to thicken. And when the heart muscle thickens too much, it loses flexibility. It can't relax properly between beats. That's called diastolic dysfunction. And it's one of the most common causes of heart failure in people over 70. Not because the heart is too weak to pump, because it's too stiff to fill. I can already hear some of you thinking, if this medication is so problematic, why do doctors prescribe it? And that's a fair question. The answer is that for many people, the benefits outweigh the risks. This medication saves lives. It prevents strokes. It reduces heart attack risk in high-risk populations. The problem is not the medication itself. The problem is that the system doesn't build in time for the follow-up conversation. The conversation about nutrient depletion, about supplementation, about monitoring for calcification. That 12-minute appointment doesn't allow for it. So the prescription gets written, the patient takes it, and the side effects accumulate quietly in the background. Here's what I wish every doctor had time to say. If you're going to be on this medication long term, you need to supplement with vitamin K2, specifically the MK7 form, Asternitneb. 100 micrograms daily. Vitamin K2 activates the proteins that pull calcium out of your arteries and put it back into your bones where it belongs. It doesn't interfere with the medication. It just protects you from one of its most serious long-term consequences. And it costs less than $15 a month. Starting tonight, 2 more items after this one. And item 4. That's the one that even I had a significant blind spot about for the first 15 years of my career. Stay with me. 4th, this medication increases your risk of developing insulin resistance, and insulin resistance drives heart disease after 60. This medication interferes with how your pancreas releases insulin. It doesn't cause diabetes outright, but it nudges your blood sugar higher, just slightly. Over months and years, your fasting glucose creeps up. From 95 to 100, then 100 to 110. Your doctor sees it and says, keep an eye on that, but nobody explains what it means for your heart. When your blood sugar stays elevated, even in the pre-diabetic range, it damages the inner lining of your blood vessels. That lining is called the endothelium. And when your endothelium is inflamed, cholesterol particles begin to lodge in the walls of your arteries. That's how plaque forms. Not from eating eggs, from chronic inflammation driven by elevated blood sugar. And this medication contributes to that elevation. I didn't fully appreciate this connection until about 10 years into my career. I was seeing patient after patient who was on this medication with good blood pressure control but worsening coronary artery disease. Their cholesterol was managed, their diet was reasonable, but their plaque burden was increasing. When I started looking at their fasting glucose and hemoglobin A1C levels, I saw a pattern. Many of them were were in the pre-diabetic range. Not diabetic, but not normal either. And when I dug deeper into the research, I found study after study showing that this class of medication increases the risk of new-onset diabetes by 20 to 30%. That's not a small number. Which of these risks do you recognize in yourself? Have you noticed your fasting glucose creeping up since starting a blood pressure medication? Tell me in the comments. I read every single one. Here's the fix. If you're on this medication and your fasting glucose is above 100, talk to your doctor about checking your hemoglobin A1C. That test shows your average blood sugar over the past 3 months. If it's elevated, you need a plan, not just to watch it. To bring it down, that might mean adjusting your diet, reducing carbohydrate intake, intering, especially refined carbs and sugars. It might mean adding a walk after dinner every night, or it might mean switching to a different blood pressure medication that doesn't carry the same metabolic risks. There are alternatives. Your doctor can help you find one that works for your specific situation, but you have to ask. Because in a 12-minute appointment, this conversation doesn't happen unless you bring it up. Fifth, this medication can cause a persistent dry cough, and that cough weakens your diaphragm and reduces your lung capacity, which makes your heart work harder. Your lungs and your heart are partners. Your lungs oxygenate your blood. Your heart pumps that blood to your tissues. If your lungs aren't working efficiently, your heart has to compensate. A dry cough might seem minor, but when it's chronic, it becomes a problem. You're coughing throughout the day, throughout the night. It disrupts your sleep. And poor sleep raises your blood pressure. It increases inflammation. The cough also forces you to avoid deep breathing. You start taking shallow breaths because deep breaths trigger the cough. Over months, that weakens your respiratory muscles. Your diaphragm becomes less efficient. After 60, your lung function is already declining naturally with age. But when you add a medication-induced cough on top of normal age-related decline, you're accelerating the process significantly. And many people don't connect the cough to the medication. They assume it's allergies, or post-nasal drip, or simply part of getting older. But when they stop the medication, the cough disappears within days. A patient I'll call George had this exact problem. He was 69, on this medication for 6 years. He'd developed a dry cough about 3 years in. His doctor sent him to an allergist. The allergist found nothing, then to a lung specialist. Chest X-ray was clear. Pulmonary function tests were normal for his age. The cough persisted. George's wife finally asked his doctor, could it be the blood pressure pill? The doctor switched him to a different medication. Within 4 days, the cough was gone. George told me later, I'd been coughing for 3 years. 3 years. And all I had to do was switch pills. If you've developed a persistent dry cough since starting a blood pressure medication, bring it up at your next appointment. Don't wait for your doctor to ask. Say, I've had this cough since I started this medication. Is there a connection? If the answer is yes, ask about switching to an alternative. There are multiple classes of blood pressure medications. If one causes side effects, another might not. It is never too late to make that change. I want to be honest with you for a moment. Not as a content creator. As a surgeon, I have stood at an operating table at 3 in the morning holding a heart that should never have needed my hands. A heart that was stiff, calcified, struggling to fill between beats. I have spoken to families in waiting rooms at dawn. Families who had no idea anything was wrong when they said goodnight 12 hours earlier. In case after case, the contributing factors were not mysterious. They were ordinary things. A blood pressure pill taken every morning for a decade. A magnesium level that was never checked. A conversation about vitamin K2 that never happened. A dry cough that was dismissed as allergies. These are not exotic risk factors. They are the background noise of millions of ordinary mornings. Pills taken with breakfast. Symptoms brushed aside. Questions never asked. And that background noise, accumulated night after night, year after year, hardens arteries, weakens hearts, creates the exact conditions that bring people to my operating room. I want to tell you about a patient. I'll call her Diane. 72 years old, retired librarian, sharp as ever, loved to garden. She came to me after her primary care doctor heard a heart murmur during a routine checkup. The echocardiogram showed severe calcification of her aortic valve. The valve was so stiff it could barely open. Diane was shocked. She felt fine. No chest pain, no shortness of breath. Just a little more tired than usual when she worked in her garden. But that murmur told a different story. Her heart was struggling. We talked about her medications. She'd been on this blood pressure pill for 14 years. Nobody had ever mentioned magnesium. Nobody had mentioned CoQ10. Nobody had mentioned vitamin K2. She looked at me and said, if I'd known, I would have taken them. Why didn't anyone tell me? 8 months later, after starting those 3 supplements and switching to a different blood pressure medication, Diane's energy came back. Her next echocardiogram showed that the calcification hadn't progressed. It hadn't reversed. You can't reverse calcification, but it had stopped. And her valve function had stabilized. The first thing she said to me was, I just wish someone had told me this 14 years ago, before it got this far. That question has stayed with me. It's a big part of why I make videos like this one. Let me summarize the 5 things we covered today. 1. This medication depletes magnesium, which your heart needs to maintain a steady rhythm. Supplement with 400 milligrams of magnesium glycinate every evening. 2. It depletes coenzyme Q10, which your heart cells need to produce energy. Supplement with 100 to 200 milligrams daily with a meal that contains fat. 3. It disrupts calcium regulation and can contribute to vascular calcification. Protect yourself with 100 micrograms of vitamin K2 MK7 daily. 4. It increases your risk of insulin resistance and elevated blood sugar, which damages your blood vessels. Monitor your fasting glucose and hemoglobin A1C every 6 months. 5. It can cause a persistent dry cough that weakens your lungs and makes your heart work harder. If you have this symptom, talk to your doctor about switching medications. Which of these 5 items do you recognize in your own experience? Have you been on a blood pressure medication for years without anyone checking your magnesium or discussing these nutrients? Tell me in the comments. I read every single one. There is someone in your life, a spouse, a sibling, a parent, a friend, who is on this same medication right now, who has never had this conversation with their doctor. Send this video to them. That one share might be the most important thing you do today. Every week I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. If you want more of that, subscribe. One last thing, and this is important. Everything I've shared today is based on published research and my clinical experience as a cardiothoracic surgeon. But your situation is unique. Your history is individual. Your combination of medications and health conditions is yours alone. Before changing anything, any medication, any supplement, any routine, please talk to your own physician first. That conversation is not a formality. It is the whole point. Better information leads to better conversations. Better conversations lead to better outcomes. That's the chain that matters. Your heart has been working for you every single minute of every single day for 68 years, 72 years, 80 years, without ever asking for anything in return. Give it this. Take care of your heart.